For this study, we'll be using indium-111. The adult dose is going to be 0.3 to 0.5 millicuries. We will have to weigh that and make sure everything is the appropriate amount. So we'll measure it and make sure it's the appropriate amount for the timing that we have for our patient coming in.
The duration of the procedure, which the procedure could be up to 3 to 4 hours, and we may possibly have to have them come back for an additional imaging depending on how their body rids the pharmaceutical in the later stages of the procedure.
Another process, a part of this study, is dealing with blood. With the blood, we will have to take blood from the patient and then put the blood back in. There is a specific process that we have to go over with the patient to ensure that they understand what's happening here.
Before we even start the procedure of collecting the blood sample from the patient, we would have to discuss with the patient and inform them that, hey, we're going to draw a little bit of your blood, and then we're actually going to take it to the lab to have it tagged with the radionuclide. That means it's going to be tagged with radiation. Now, the amount of radiation is very minimal, so the risk of an exposure to a bad amount of radiation is very minimal. In doing so, we would also have to let the patient sign a consent form stating that it's okay for us to take their blood, tag it, and then reintroduce it into their body so that the imaging and the therapy can be done. Once we have the blood sample withdrawn from the patient, we take it to the lab. We put it through a centrifuge. The centrifuge will separate the platelets from the plasma and red blood cells. That way that there is no clotting. After that, it is tagged with the indium-111, and preferably to 1 to 3 hours, the tagged white blood cells are reintroduced into the body. Generally, it is better to have the 1 hour time frame versus the 3 hours because the longer the period it takes for the tagged white blood cells to go through the system, the less viable it is. Watch as she dons her gloves.
We will advise our patient to utilize the restroom
at all times.
frequently after they've had a lot amount of water. At this point, they can leave and come back as long as they come back within the time frame. But we would like them to avoid previous to the imaging to avoid any other contradictions or any other artifact in the study.
There we go.
Now show it.
There we go. Right.
After boarding, we'll get our patient on the table. We will re-explain brief instructions about what is about to happen. They will lay supine on the table. We will put them through the tube where we will watch the blood flow phase,
You pause it.
the blood pool phase,